Nancy Salazar. AIDS, acquired immunodeficiency syndrome, is a disease of the immune system caused by an infection with human immunodeficiency virus. It is transmitted primarily via unprotected sexual intercourse, contaminated blood transfusion, hypodermic needles, and from mothers to child during pregnancy, delivery, or breastfeeding. Some bowel fluids, such as saliva and tears, do not transmit HIV. Prevention of this infection primarily through safe sex and needle exchange programs. It is a key strategy to control the spread of disease. There is no cure or vaccine.
This year in the United States, 42,000 people will become infected with the virus that causes AIDS. AIDS is an incurable disease that is the end result of infection by the human immunodeficiency virus, or HIV. An individual who contracts HIV may become sick quickly or can live symptom-free for years. HIV and AIDS are not one and the same. Those with AIDS are infected with HIV, but people infected with HIV do not necessarily have AIDS. A person has AIDS when their T-cell count falls below a measurement scale of 200, as opposed to the 500 to 1500 in a healthy person. An extremely low CD4 count means that a person's immune system is no longer healthy enough to fight off intruding viruses and bacteria. Signs that HIV may be turning into AIDS include extreme fatigue, rapid weight loss, persistent diarrhea, a high fever, and swollen glands in the neck, armpits, or groin. Even if a person doesn't have a low CD4 count, they are still classified as having AIDS if they contract any one of 26 opportunistic conditions. These are a group of illnesses that don't generally occur in people with functioning immune systems, but do show up in AIDS patients. Two of these are cancers. One, Kaposi sarcoma, results from a tumor in the blood vessel walls and appears as disfiguring pink or purple lesions on the skin and mouth. The other cancer, non-Hodgkin's lymphoma, originates in the disease-fighting blood cells known as lymphocytes. This appears as swelling of the lymph nodes. Several opportunistic conditions that confirm an AIDS diagnosis stem from invading bacteria like tuberculosis and recurrent bacterial pneumonia. Pneumocystis carinii pneumonia is a potentially deadly inflammation of the lungs that is one of the most common infections occurring in people with HIV worldwide.
HIV has had great impact on the society, both an illness and a source of discrimination. The disease also has significant economic impact.
AIDS stands for Acquired Immune Deficiency Syndrome, which means deficient immune system. You get AIDS after becoming infected with the HIV virus. You get infected with the virus by unsafe sex, contact with blood of an infected person, for example by using a contaminated injection needle, from mother to child during pregnancy, childbirth, or breastfeeding. Because the virus is transmitted through blood, sperm, vaginal fluids, pre-seminal fluid, breast milk. You don't have the risk of becoming infected with the virus by saliva or shaking hands. When you have HIV virus but aren't symptomatic yet, you are seropositive. That means that there are HIV antibodies in your blood. You don't need to have any signs of disease yet. An HIV infection passes through 4 stages. In the first stage, the body can show signs of disease like continuous fever and swollen glands, while some people who are infected remain asymptomatic in their first stage. In the second stage, recurring airway infections, skin, mouth, and genital lesions often occur. In the third stage, you may have complaints like prolonged diarrhea, excessive weight loss, tuberculosis in the lungs, and other serious infections like meningitis. Finally, besides serious infections, the nervous system may be affected in the fourth stage, which can result in motor loss or AIDS-related dementia. It may take 5 to 15 years before you know that you've got AIDS. This is because sometimes it takes longer for symptoms to occur.
It is a cause of the spectrum of disease known as HIV. HIV is a retrovirus that primarily infects components of the human immune system, such as CD4 and T cells, macrophages, and dendritic cells. It directly and indirectly destroys CD4 and T cells.
Targeting HIV replication. The replication of HIV-1 is a multi-stage process. Each step is crucial to successful replication and is therefore a potential target of antiretroviral drugs. Step 1 is the infection of a suitable host cell, such as a CD4-positive T lymphocyte. Entry of HIV into the cell requires the presence of certain receptors on the cell surface. CD4 receptors and co-receptors, such as CCR5 or CXCR4. These receptors interact with protein complexes, which are embedded in the viral envelope. These complexes are composed of two glycoproteins, an extracellular GP120 and a transmembrane GP41. When HIV approaches a target cell, GP120 binds to the CD4 receptors. This process is termed attachment. It promotes further binding to a co-receptor. Co-receptor binding results in a conformational change in GP120. This allows GP41 to unfold and insert its hydrophobic terminus into the cell membrane. GP41 then folds back on itself. This draws the virus towards the cell and facilitates the fusion of their membranes. The viral nucleocapsid enters the host cell and breaks open, releasing 2 viral RNA strands and 3 essential replication enzymes: integrase, protease, and reverse transcriptase. Reverse transcriptase begins the reverse transcription of viral RNA. It has 2 catalytic domains: the ribonuclease H active site and the polymerase active site. Here, single-stranded viral RNA is transcribed into an RNA-DNA double helix. Ribonuclease H breaks down the RNA. The polymerase then completes the remaining DNA strand to form a DNA double helix. Now, integrase goes into action. It cleaves a dinucleotide from each 3' end of the DNA, creating 2 sticky ends.
Prognosis. It has become a chronic rather than an acute fatal disease in many areas of the world. Prognosis varies between people, and both the CD4 count and viral load are useful for critical outcomes. Without treatment, average survival time after infection with HIV is estimated to be 9 to 11 years, depending on the HIV subtype. AIDS, HIV, María Elena Sánchez Alopar.